My name is Pat. I am Donnie's therapist, and we are going to get started. Based on the symptoms presented, the best diagnosis for Donnie is schizophreniform disorder. Donnie exhibits delusional beliefs, including being followed by foreign governments and having secret information on the CIA. These are all examples of persecutory and grandiose delusions. Donnie's refusal to hug her parents, along with uneasiness and lack of recognition of her own home, suggests disorganized behavior and a significant change in her typical personality and social interactions. The symptoms present have been present for approximately 4 months, but too short of the 6-month duration required for the diagnosis of schizophrenia, a differentiating factor. A drug test ruled out substance use as a cause for her symptoms, eliminating a substance-induced psychotic disorder. Her parents' concerns, her friends' observations, and her general odd behavior indicate a significant decline in her functioning. Based on current information, schizophreniform disorder appears to be the most fitting diagnosis. Her symptoms align with criteria for this disorder, which include delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and negative symptoms lasting for at least 1 month but less than 6 months. Brief psychotic disorder is less likely due to the longer duration of her symptoms and lack of full remission. Professional views on the psychopharmacology of schizophreniform disorder are complex and multifaceted, largely because the disorder itself is a diagnostic crossroads. It is treated as an initial acute psychotic episode that may or may not evolve into a chronic condition like schizophrenia. The core psychopharmacological issues, therefore, revolve around the urgency of treatment, the choice of medication, managing side effects, and crucially, the duration of treatment. The most effective treatment for a condition like Donnie's would likely involve a combination of medication to manage acute symptoms and psychological therapies to help her and her family cope with the condition and prevent future relapses. The medical model views psychological disorders as diseases with biological causes. It assumes that the presenting symptoms are a result of an underlying biological or physiological dysfunction. The psychological model, in contrast, sees schizophreniform disorder as a result of psychological issues, social and environmental factors. It emphasizes the role of the person's life experience through patterns and coping mechanisms. The key symptoms suggest a potential diagnosis of a psychotic disorder, most likely schizophrenia or a related condition. The selection of atypical antipsychotic is justified based on the neurobiological understanding of the disorder and the therapeutic goals of symptom reduction, improved functioning, and a favorable side effect profile that supports long-term adherence. Her delusions and paranoia could stem from an overassignment of meaning to irrelevant stimuli, possibly due to excessive dopamine activity in the mesolimbic pathway and disruptions in the prefrontal cortex and limbic system. Her altered social interactions, odd behavior, and uneasiness with her parents align with negative symptoms and impaired social cognition involving areas like the medial prefrontal cortex and amygdala. Elevated cortisol and HPA axis dysfunction are common in early onset psychosis and linked to symptom severity. These suggest that the stress of college could be a contributing factor for Donnie. Based on the information provided, it's highly probable that Donnie is experiencing a psychotic episode with symptoms pointing towards schizophrenia or a related psychotic condition. The agent in this case is not a drug, as the drug test was negative, but rather the underlying neurobiological and psychological processes that are causing these symptoms. Antipsychotic medications would likely address the underlying neurotransmitter dysfunction, leading to a reduction in her psychotic symptoms and a subsequent improvement in her behavior. The biggest hurdles are noncompliance due to lack of insight and paranoid delusions, side effects of medication, which can lead to further noncompliance, and difficulty engaging in therapy due to paranoia and cognitive symptoms.